They say a dog's a man's best friend, and we all know what it's like to look after a best friend. There's a contagious respiratory disease in dogs that you want to know about, and the details about what you can do and how to look out for it are coming up on Polk Place. Welcome to Polk Place. I'm your host, Jeremy Morady. And with us today, we've got two guests, Veronica Soliski, who is a certified veterinary technician with SPCA Florida. And we also have Belinda Reynolds, who's the practice director for SPCA Florida's Riva McClurg Animal Medical Center.
Yep. Hi.
So thank you guys for both coming in.
Thanks for having us.
And who is our other special guest here?
So this is Schuyler. She's a 1-year-old Chihuahua mix that we've had at the clinic for a couple of weeks now. And she's super sweet, obviously a really good lap dog, loved the car ride. Little bit shy, but she loves treats, so she's a good companion.
Yeah, she's been chowing down on the treats since
Yeah.
she's been here. So.
Definitely, for sure.
Definitely helps warm her up too. Well, I want to talk a little bit about this case for the respiratory virus that's kind of popped up in the last few months. But let's give an overview first for the folks that aren't familiar with you on what you guys do before getting into the medical aspect there.
Sure. So at the medical center, we are a full-service veterinary hospital. We do spay and neuters, not only for the shelter animals, but for public-owned animals. We have, full wellness care packages, vaccines, flea and heartworm prevention. We can do dental procedures, some minor surgical procedures as well, and just do preventative wellness care, senior care for the life of the pets as well.
Okay. Now, tell us a little bit about this virus going around. That I first heard about it, a few months ago. Don't really know a whole lot about it other than what I've kind of heard, bits and pieces from friends. Kind of give us a broad overview if you can.
Yeah, so canine influenza is a pretty big respiratory virus going around in the dogs right now. The way I've kind of been describing it to people is it's not quite as bad as pneumonia, but it's a little bit worse than your normal kennel cough. And there's two different forms they can get. They can have a mild form of canine influenza where there's just a little bit of coughing, but the coughing lasts for quite a while. It can last like up to 30 days. And they can also have like some eye discharge, nose discharge, things like that. You might see some lack of appetite. But there's also the severe form, which we are seeing. Some of your older pets or your sickly pets, if they're kind of known to be sickly anyway. And the severe form includes they just kind of stop eating, they can become very dehydrated, lots of moist coughing for, again, like up to a month long. And so they need to be hospitalized usually. They get really high temperatures and very sick. So usually this is the point where they need like IV fluids and things like that. They get it from coming into contact with the virus. It's aerosol. So we've been hearing about it mostly through the dog shows, things that go to the boarders and the groomers where they're in contact with other dogs. And I think the thing that's making it so bad right now is because it's a new strain of the virus. No dogs have been in contact with it yet to become immune to it.
So no
pretty
one's really
much,
protected from it.
Yeah, pretty much nobody's protected from the virus at this point.
Well, now you mentioned kind of a moist cough. Can you kind of describe that a little bit more for folks? Is that like with the congestion and sounds a little bit not just that?
Yeah, exactly. So it's not, every dog, sometimes they come in and they're like, oh, well, my dog's been coughing a little bit. It's not just going to be like, oh, he's sniffing around, kind of does a cough. It's going to be like from the deep in the chest, and it's going to become chronic. And like, again, it lasts from 10 up to 30 days long. So it's not something it's going to be coughing once today. It's going to be okay tomorrow. It's going to be progressive, and it's going to last a while.
So pretty persistent then. Okay. Now, with this, and none of these dogs really having any exposure to it before, is there anything you can do to prevent it? Are there any vaccines out there, or even if they do get exposed to it, how can you treated at that point?
Definitely. So there is a vaccination available with all the respiratory and influenza that's been going around. The manufacturers have made a vaccine. They can get the vaccination as young as 8 weeks old, and it does need a booster. So if your dog would get it today, it would need another vaccine in about 3 or 4 weeks just to booster the immunity in the pet. It's more of a lifestyle vaccine, so if you have an animal that stays at home most of the time, isn't really around other pets, you can kind of decide whether or not your pet needs it. But if you have a social animal that's going to be going to the groomers or the boarders or the dog parks or traveling with you, it's definitely recommended they have it done.
At the point that you kind of notice, okay, this isn't a kennel cough, this is something a little bit more severe, and it's leading up to it, how do you guys approach a treatment?
So we've changed our protocols a lot at the clinic with respiratory cases with all the influenza that's been going around. Now, if we have a person call ahead of time, if they're reporting a type of cough, we'll have them wait in their cars before they enter the clinic to see the doctor. That way they're not contaminating the lobby potentially, since we're not sure. They may not have influenza, but God forbid they do, then you're kind of dealing with, it could potentially spread to the other patients in the waiting room. So we'll have them wait on their car. They get loaded straight into the exam room, and we're definitely tough with our disinfectant protocols afterwards. Now, there isn't exactly a test that we could know that day that your pet has influenza, but if we're suspicious, we can run a test. We'll take a swab of the nose, the conjunctiva, as well as down the throat, and we send it off to the lab, and it takes about 3 days to get that back. So depending on your pet, if it needs hospitalization, we'll put it on IV fluids, treat it symptomatically for the time being, and it's under a strict isolation protocol, so we'll gown up, keep him isolated from any other pets until we get that testing back saying, yes, it's influenza, keep this pet isolated, make sure you're continuing disinfectant, or if it comes back as not influenza, then you can kind of decide where to go from there, how strict your isolation protocol should be for that creature. So.
Okay. Now, with owners coming in contact with different animals and stuff like that, is there any transfer to humans with this virus?
It's an aerosol virus, and it's been known canine to canine, so it can't go to your cat, it can't go to a person from a dog that has influenza, but potentially if you get sneezed on by a dog and then you go and pet another dog and they sniff that same area, there is a potential that it can go to the other pet as well. So we've been really strict with hand washing. Like I said, if we know the animal has influenza, then you're gowned up in isolation gear, and then if you're not sure if your pet is sick or not, or if the other pet is sick, just taking as much preventative measures as you can not to spread it to the other animals. So like changing your clothes, changing shoes between pets and things like that. So.
Okay. Does the time of year matter at all? I mean, in your time in the clinic, do you see this pop up at certain times of the year, or same with other viruses and whatnot, kind of like humans?
I would think, and Veronica can answer this better than I can, we started seeing it probably, about a month ago, more, when it becomes summer and spring, when the more hot temperatures, because there's nothing there that can kill it. And that's when they're more active in the dog parks, the dog shows, that we talked about earlier, when people are out socializing their animals more.
Okay.
Yeah, I agree. It's so new, we're still not really sure if there's a season for it, but it's been prevalent, and we haven't really seen it slow down yet. So
now, if you're a business that caters to dogs, are there any certain things that you should do to clean things, to disinfect, to prevent spreading that in case it is in your facility?
Definitely. I know in the animal industry, people are paying more close attention. So if a person's dog is coughing or sneezing, they won't allow it to come into the facility, like to even be boarded or groomed at the time now. I know everyone's being really strict. And as far as disinfection goes, I know there's certain cleaners that have been known to like kill different viruses and things like that. So letting the spray sit, bleaching everything after an animal leaves in between, even if we don't think they're sick, just doing it anyway, just for good measure. I know a lot of places have been following that as well.
Okay.
And I think a lot of the businesses that do cater to pets, such as groomers and boarding facilities, now are requiring the canine influenza vaccine in addition to the other required vaccines.
Okay. Anything that I'm leaving out for you guys?
Nothing I can think of.
The SPCA does offer the vaccinations. We have them in our clinic. So if you're not sure if your pet's up to date, you can always give us a call or bring it in, and we'll do the initial vaccine checkup and make sure your pet's nice and healthy. And then they'll receive the booster about 3 or 4 weeks after that.
Okay.
And they can get it out on our wellness wagon as well.
Yep.
Sounds wonderful. Well, thank you guys so much
Thank
for
you.
coming
Thank
in.
you for having us.
Bye.
Goodbye.
SPCA Florida wants you to know that canine influenza, also known as dog flu, is contagious respiratory disease in dogs caused by specific type A influenza viruses known to infect dogs. The signs of this illness in dogs are cough, runny nose, fever, lethargy, eye discharge, and reduced appetite. But not all dogs will show signs of illness. The severity of illness associated with canine flu in dogs can range from no signs to severe illness resulting in pneumonia and sometimes death. Most dogs will recover within 2 to 3 weeks. However, some dogs may develop secondary bacterial infections, which may lead to more severe illness and pneumonia. Anyone with concerns about their pet's health or whose pet is showing signs of canine influenza should contact their veterinarian. For more information, you can contact SPCA Florida at 863-646-7722 or look them up on the web at spcaflorida.org.